Hello, everyone. This is Jill Swartz from Specialty Med Training, and I'm delighted to be here with Lamia Gabal, a Prestige Medical Group in Santa Ana, California. Dr. Gabal is a board-certified urologist, and we're going to have a wonderful conversation here about what it is that she does and what makes her special in the marketplace and her niche, if you will, in urology. So not only is Dr. Gabal a urologist, but she's a female pelvic reconstruction surgeon, and she specializes in that area. And then there's this whole new realm, and it's not really new, but it's certainly what we're going to discuss about today. It's solutions for male and female sexual dysfunction that she is currently treating her patients with, but really having to find a different, more innovative approach to helping them because it's something that's not covered in the insurance world. So without any further ado, Dr. Gabal, hello, how are you?
Hello, Jill. Thank you. I'm really good today. Thank you so much for having me. And I'm excited to talk about these really wonderful therapies.
Yeah. So let's just start with the type of patients that you're seeing now. What are you doing day to day in your practice?
So urology is a very busy specialty, and every day we deal with so many different types of things, including kidney stones and bladder cancer and urinary tract infections. But some of the most exciting things I think that we deal with now is regenerative medicine for erectile dysfunction and sexual dysfunction, both in men and women. There's so many new things that are on the horizon that we can offer our patients. So that's what's so exciting to me about treating those entities, is that it's not the same old thing anymore, you know?
Yeah. So, of course, specialty med training, we train lots of doctors in these different regenerative therapies. But I think what we really want to kind of openly discuss, more layman, if you will, to your patients, not just why you're helping them now with different areas of dysfunction, albeit including erectile dysfunction, correct, and likes, I'm sure, and like as you said, in all of these different areas. But there's so much talk about regenerative medicine and these different therapies like shockwave and PRP. So if you could just dive in a little bit, but in a layman's way, to explain what exactly are those and what kind of conditions and problems are they solving for your patients?
So we've been very successful in helping our patients with these conditions. The two mainstays of therapy in our practice for regenerative therapy would be shockwaves for erectile dysfunction and also PRP, or platelet-rich plasma, both for orgasmic dysfunction in women and erectile dysfunction in men. So shockwaves, I know that sounds daunting every time I talk to a patient.
Yeah.
I'm starting to call it acoustic wave therapy because shockwaves almost sounds like we're going to shock the penis, and we don't do that, I promise. It's painless. It is sound waves that are delivered to the entire penis, and then, you know, the penis is also behind the testicle, so that whole area it's delivered in a series of treatments, usually once a week for 6 weeks or 12 weeks, depending on how severe your erectile dysfunction is. And basically, I liken it to like a laser therapy for my face. What we're doing is we're creating low-level cellular damage. Again, I promise it's painless. This energy is being delivered directly deeper into the tissues where we want it. And then we are regenerating younger, healthier tissue. So nerve endings and collagen and elastin and all the things that we need in order to have a good and full erection, in order to be able to have intercourse. So really, it's just amazing how the ultrasound waves, these ultrasonic sound waves, can help to cause this low-level cellular damage. And then when you add PRP to that, which is platelet-rich plasma, and a lot of people aren't familiar with what PRP is. So we take 60 cc's of blood out of your arm, not from the penis. That's always something that people are worried about.
Right.
But we take it out of the arm, and then we spin it down to about 8 cc's of this very concentrated healing factors. So we're taking platelets and inflammatory factors and all of these really good things that your body needs to regenerate. And we inject it back into the penis with a very tiny needle after numbing for a while. And honestly, it is very minimal discomfort for so much gain. And we see such incredible results because we're using your body's own natural tissue in order to regenerate younger, healthier tissue. And, you know, the orthopedists have used these techniques for many years in their practices. Also for aesthetics, plastic surgeons, aesthetics, that they've used these techniques for many years. And so now we're seeing such success when we apply these therapies for female and male sexual dysfunction. And for women, we would inject the PRP into the G-spot in the vagina, just at the front of the vaginal wall, again, with local anesthesia. So we're numbing it. It's very minimal discomfort. And when you add the ultrasound therapy to that, again, low level cellular damage causing the rebuilding of younger, healthier tissue. And we get such amazing results.
That's such a great explanation. And I think it's important to add both acoustic wave therapy and PRP are not new to medicine. And even though it's new in this whole regenerative, finding really new ways to regenerate cellular tissue and function by combining these different things. But acoustic wave was also used in urology for kidney stones, right?
Yes, for many years.
Yes, and then PRP way back, I mean, it's still today used in, it was started in cardiology, but used for wound healing because of its regenerative cellular properties, right? All those rich in monocytes. So I think I would like to stress a little bit more when you kept saying painless. It really is, it's evolved, right? I mean, the therapies have come such a far way, but you're using that focal device in shockwave. And I think it's important maybe to discuss that because there's all different people maybe advertising that they're doing this, but what's really, really important is what type of PRP are you using, because not all PRP is created equal, and what type of shockwave therapy, because there's all types of different devices too. And the device that you use is painless, and it is specifically studied in urology. So if you could speak a little just to that, just so that the layman understands.
Those are very good points, Jill. And I have to say that when we first started doing the ultrasonic therapies, the acoustic wave therapies for our patients, we were using the radial device. Basically, there's two different devices. One is focal and one is radial. And what that means is when we're delivering the energy, if you're using the focal device, it goes down to more of a pinpoint deeper into the tissues where we want the energy to be delivered. And so there's no nerve endings in that area. So it really is painless. When you're using the radial device, which is what we had started out using and did not actually have as good of results, to be honest, with the radial device, it is much more painful because the energy is delivered in a radial fashion. So it's a bigger area. It mostly gets soaked up by the skin and doesn't get to the deeper tissues. And it is uncomfortable, you know, on the skin. So the radial device better, it works better. It's less discomfort, really no discomfort. And really what was studied in the urological literature and what should be used for erectile dysfunction and for female sexual dysfunction. For the PRP, you're right. Not all PRP is created equal. Some practitioners will really just use a urine centrifuge and call it PRP, and that's not good at all. We use M-site, which has been proven to really have the highest concentration of the healing factors into the PRP, and the cleanest and most pure PRP, that we're not adding things that would take away from how effective that platelet-rich plasma is. And so we've seen amazing outcomes with using the M-site machine and also using the focal therapy device.
Great, thank you. And I think it's important for your patients to understand, because like we said, there's a lot of people that say perhaps that they're doing this and they're offering PRP or shockwave. But if it's not using the most studied and advanced equipment and devices, the person who's really losing out is the consumer. So it's really important for your patients to do their due diligence. You know, it's not price. And people are advertising, you know, why is it so expensive? Why isn't it covered under health insurance? Well, I mean, those are great questions, but you're not able to really help your patients under the current constraints of insurance. And that's finally what I'd like to talk about, because you wish you could, that 8-minute visit is all the time that you're required, that you're able to deal or to attend to. And when you know that these therapies are really, really could change, be game changers for their condition. So
well, I don't even get me started on insurance companies and who they're in it to help. It's definitely not to help patients, and it's definitely not to help the physicians. But that being said, there are so many things that are very late for the insurance companies to adopt in terms of payments, and they might consider things investigational when we really know in our practices that it's not investigational and it's something that they just don't want to be paying for. But we also know that these things work. It took them a very long time to cover many of the pills that are available now for erectile dysfunction. And the pills work, and the insurance company will limit a man to a certain number of pills per month. And they're essentially saying that's the only number of times you can have sex a month. And there are many men.
Crazy.
It is crazy. And there are many men for whom either the pills don't work or they can't use them because of an interaction with another medication, or maybe they don't want a chemical in their body, right? And those are the only options really that are covered, and not covered very well by insurance. So if we want something that we know works well, that we know we're using your body's own natural tissue to regain function, where then maybe you don't need the medications, then these are the therapies, the regenerative therapies that are on the forefront.
Yeah. And kudos to you sincerely and all the other practitioners who dare to jump outside of that and understanding they can't help their patients under that current model. So it's a big leap of faith, because it really is not only the investment you have to make in the equipment and the devices, but because and you're the ones moving this whole field forward, because you're using it in clinical practice and seeing the results. So I'm honored.
You are a big impetus in all of this as well. So thank you.
Yeah, well, I'm honored and blessed to work with such progressive doctors who really are trying to change, change their patients' lives. These are life debilitating, seriously suffering conditions. And these really are game changers. Well, Dr. Gabal, I'm so thrilled that you were able to spend this time with us. I really appreciate it. And you guys, if you want to learn more, you really, really have a great physician and her whole practice, and which is a multitude of several different providers who are offering these solutions. So don't hesitate. Why don't you tell us, where can they contact you, Dr. Gabal?
So Prestige Medical Group, we are located in Santa Ana, California, and you can look us up on our website, which is prestigemedigroup.com, MEDI, or you could search up Dr. Gabal, DRGABAL. I'm sure I'll come up there somewhere.
What's your phone number? How about a phone number?
Our phone number is 949-825-7650.
Okay, great. Thank you again, and have a wonderful day.